Hi everyone, I am going to explain about infusion and injection coding. So what is this infusion and injection? What are the CPT codes and how to code the infusion and injection? I will explain. So these are coded mostly in the inpatient, outpatient, emergency department services. So the index is here. You can see infusion and injection terminologies: infusion, push, hydration, intramuscular and inhalation. So these are the services and how to code these services, and I'll be explaining with some scenarios also. So first we will see what is infusion. Actually, what is infusion? Infusion is nothing but it's the administration of drugs to the patient to treat the condition. See, suppose when patient is having any condition or disease, so what physician will do? He will treat that patient in the form of bags like this, which consist of drugs. So the drugs are given in the form of bag like this, which consist of antibiotics, drugs, antiemetics, and this is given to the patient to treat the condition. So it's nothing but an infusion. Infusion is nothing but administration of drugs to the patient in the form of bags like this. So some of the examples are like banana bags, heparin, nitroglycerin, like that. So next we will see what is IV piggy bag. So it is also a administration of drug to the patient, but in this it consists of two bags like this. One is primary and another is secondary. The secondary bag is attached to the primary bag with the help of clamp like this, and this is given to the patient to treat a condition or disease, and it is given intravenously, that is through veins it is given. So it is also the administration of drugs, but it consists of two bags like this, and this is given to the patient to treat the condition. So now we will see the CPT codes and how to code the CPT codes and what is the minimum time to code the infusion codes. So these are the CPT codes of the infusion. See, we have total 4 codes for the infusion. We will see one by one. 96365, 96366, 96367, and then 96368. So these are the infusion codes. Now we will see one by one in detail. 96365, initial infusion up to 1 hour. So whenever a patient is having a condition, the physician will treat the patient, right? So the drug which is given to the patient, so the drug, if it is infused till 1 hour, and that is the initial, that means the primary drug which is given to the patient. See, suppose from 9 to 10 he is giving, so drug A is giving to the patient. So it is the initial drug. So the initial drug which is given to the patient, the initial infusion, if it is running from 9 to 10, that is 1 hour. So the primary service which is given to the patient to treat the condition is known as the initial infusion. Infusion is nothing but administration of drug, right? So the drug A, if it is running from 9 to 10, that is 1 hour, and it is the primary service the physician is giving. So it's nothing but the initial infusion. So we will be billing 96365 to the drug A. Next, if again the drug A is running continuously for the additional hours. See, from 9 to 10 the drug A is running, right? So again from 10 to 11 it is running. So for that additional hours we have to code 96366, and the minimum time is greater than 30 minutes. So greater than 30 minutes only we have to go this 96366. So when we are doing live charts, so you will be understanding betterly. So this is the initial infusion. If it is running additionally for the additional hours, the initial service is running for the additional hours, we have to code 96366. 96367, it is sequential infusion up to 1 hour. So what is the sequential infusion? It is nothing but when a new drug is given to the patient following the initial service or primary. See, this is the initial service, right? So following this initial, if suppose a new drug is running, see, drug A is the initial drug. right? From 9 to 10 it is running. Suppose if a new drug, drug B is running, drug B is nothing but it's a new drug. So if it is running after after 9 to 10, that means from 10 to 11, if it is running drug B, so it's nothing but the sequential infusion. This is different and this is different. For the additional hours we have to code this. If the same drug is running continuously for 1 or 2 hours, so we have to code this. Suppose if apart from additional hours, if a new drug is given following the initial service, so we have to code the sequential infusion. For more better understanding, here we have the scenarios, no need to worry. So while doing this you will be understanding betterly. Sequential is nothing but following this initial infusion. After the initial infusion of 1 hour, if suppose new drug is given, so it's nothing but the sequential infusion. What is concurrent infusion? 96368, and this code is reported only once per encounter. How many infusions of concurrent are given? We will be billing only once. Concurrent is nothing but, suppose multiple drugs are infused, multiple drugs are running simultaneously through separate bags, but it's been running through same IV line. For better understanding, see, let us think that this is drug A, this is drug B. So these two drugs are running parallelly, simultaneously. Suppose 1 to 2 the primary drug is running. Again from 1 to 2 the another drug is running. So parallelly the two drugs are running in the same time, 1 to 2, and again 1 to 2 another drug is also running. So these two are running in the same time, and same time if it is running parallelly simultaneously, we will call it as concurrent infusion. But though these are separate bags, but these are running simultaneously through one single IV line, so it's nothing but the concurrent infusion. So we will see some guidelines to code the infusion codes. So whenever we receive the report of infusion coding, so we have to see some points. So we have to follow some guidelines. So we have to see the start and stop time, and we have to see the IV line where it is given, that is nothing but the route, and next we have to see the status whether it is complete or discontinued, and we have to see the initial infusion time. That is, to code this initial infusion, if it is running 16 minutes only, we have to code 16 minutes or more than 16 minutes only, we have to code the initial infusion. Otherwise we should not code the infusion. See, suppose the initial service is running from 7 to 7:16, that means 16 minutes it's running, so we can code the infusion, initial infusion. So if it is running less than 16 minutes, we should not code as infusion, that is we should not code 96365. Instead of that we will be coding as IV push. This we will be seeing in the later sessions. For the subsequent infusion we need 31 minutes. That's nothing but for the additional hours, as we have seen, right, we should report this greater than 30 minutes. That means we should have minimum 31 minutes. For the initial we should have 16 minutes. Now we will see some scenarios. See, as I told, right, this is a drug, and we have to see the start time, stop time, and then the location, and then here is the status. If it is incomplete or discontinued, we should not at all code that. If it is complete only the status, then only we have to code the services. So here we have Jofron. So the start time is 9 o'clock and stop time is 11 o'clock. So for how many hours it is running? It's running for 2 hours. So this is the initial service given to the patient. So 9 to 11 means 2 hours, right? So 9 to 10, 10 to 11. So for 9 to 10 we have to code what? As I told, right, for the initial we have to code 96365, and then for the next additional hours, that is from 10 to 11. So from 9 to 10 I am coding 96365. For the additional, that is from 10 to 11, what we have to code 96366. As I told, right, for the additional hours, see here, as I told, right, for the additional hours we have to code 96366. For the initial we have to code this one. So that is the concept. So from 9 to 10 we have to code 65. For the additional hour, that is 10 to 11, we have to code 96366. So like this we have to code. Suppose if the same drug is given to the right side region, this is the left anticubital, right, and the same thing is given, the same drug is given to the right anticubital. So how to code this we will see. This should be coded as 96365 with the excess modifier. These modifiers I'll be explaining in the next upcoming courses. So as for now, this is the modifier. Excess is nothing but this is used to identify that this is the drug which is given to the separate structure. This is the left anticubital, this is the right anticubital. So the same initial code we have to give, but we need to append the modifier excess. That means the initial service is given to the right anticubital region. Okay, so this is the concept. So when to give the same services, initial services 6565, but it is given excess modifier. Why? Because when it is given to the another different anatomical location. See, this is the left and this is the right. So I am giving the same 6565, but we have to append the modifier excess modifier. So whenever the same drug is given but to the another region, this is right side and left side, so we have to code the 9 to 10 means we have to give 96365 initial service with modifier excess. That means separate structure. This is the left and this is the right side. To identify that we are giving this modifier. Next we will see the remaining CPT codes scenarios. Levophed is given from 7 to 9. Levaquin is given from 9:1 to 10. So here the location we have to see and the status we have to see. Complete it is location is right anticubital and right anticubital. So this is the initial service given to the patient from 7 to 9. So 7 to 9 means what? So from 7 to 8 we have to code what? 96365 as I told, right? So again from 8 to 9 we have to code 96366. That's it. This is simple coding of infusion. So the drug is running for 2 hours. For the initial hour we have to code 65 and for the additional hour we have to code 66. And see here from 9:1 to 10 o'clock a different drug. As I told, right, sequential infusion. So whenever a new drug is running along with the after following the primary service, that is after completing the initial, a new drug is running. New drug is running means what I have told, right? Sequential. New, whenever a new drug is running following the primary or initial service, so we have to code 96367. So 96367 and it is running for 60 minutes only. Suppose if additional hours it is running, so we have to code 96366, but here only 1 hour it is running, so we have to code only 67. So this is a new drug which is running following the initial service, so we have to code 96367. Now we will see the concurrent concept with scenario. NSMVI, thiamine IV medication infusion, which is given 6:30 to 7:30 and the location is right anticubital. Lidocaine 6:30 to 7:30, status is complete and the location is right anticubital. See here, this is the initial infusion service. And one more thing I forgot to tell, this is more than 16 minutes. All the services whatever we have coded till now, so all the services are more than 16 minutes, so we can code. If the services are less than 16 minutes, so we should not code the infusion, we have to code it as IV push. That is also the another concept I forgot to tell you. So now we will see the concurrent infusion concept here. So this is the infusion running from 6:30 to 7:30, right? So this is a new drug, this is a new drug, but here see the timings. The 6:30 to 7:30 it is running. Again the lidocaine is running in the same time. Simultaneously this is running with the initial drug. So first we will code this 96365. And as I told, right, if multiple drugs are running simultaneously, so what we have to code? 96368. That is concurrent infusion concept. As I told, right, when multiple drugs are running infused simultaneously, so we have to code concurrent infusion. So see here, this is a different drug, but this is running simultaneously, same time, in the same time it is running. So we have to code the concurrent infusion, that is 96368. So like that we have to code the infusion codes. So far what we have learned, what is infusion, IV, piggyback, administration of drugs, so in the form of bags. So the minimum timings are initial 16 minutes and subsequent 31 minutes. So the timings are like that. So we have seen the scenarios also. So initial code is 65 and the additional is 66. For the additional hours we have to code that. Whenever a new drug is given following this initial, so we have to code 67. And concurrent, when we have to code when different drugs are running simultaneously, that means in the same time, if they are running, see like this we have seen here, right? So it's nothing but the concurrent infusion. So this completes the infusion topic. So remaining topics, like the remaining topics are what? Push, hydration, right? So those topics I will explain in the next session. So if you have any queries, please comment below. Thank you.